Dr. Amir criticizes argument for not taking coronavirus vaccine. Sign up for latest news plus tips to save money and the environment. Subscribe. When you subscribe, we will use the information you provide to send you these newsletters. Sometimes they'll include recommendations for other related newsletters or services we offer. Our privacy notice explains more about how we use your data and your rights. You can unsubscribe at any time. Around 1.7 million people will soon be told by government officials to shield themselves from COVID-19, while hundreds of thousands of them will be moved up the priority list to get their vaccines early. A new data-driven model, based on COVID outcomes from the first spike, has identified thousands of Brits with a combination of conditions, which means they are at much higher risk than previously believed or understood. Many of these people will be moved up to the next priority group for vaccinations, which will be the 6th. Members of this group are currently being offered the vaccine, but many others will have already had the jab, having been considered vulnerable. The 820,000 who haven't already been jabbed will get a vaccine as quickly as possible, according to Deputy Chief Medical Officer Dr. Jenny Harries. Letters are expected to be sent out to alert people they could benefit from going back into shielding, but recipients of the correspondence will ultimately be able to make the choice themselves. Who is affected? At the moment, it is not entirely clear who the 1.7 million people are or what medical conditions will be included. The people implicated in the new data are likely to have a wide variety of underlying health conditions, and so will be contacted on a person-to-person basis. The Department of Health has let people make their own minds up about whether or not shield after explaining the model could be overcautious. As a consequence, some people may be alerted to a risk the department doesn't believe is worth shielding for. Those who do choose to stay in and shield will qualify automatically for medical and supermarket deliveries to their home via their local authority. This group of people will also be entitled to apply for statutory sick pay, SSP. The original shielding list was compiled of a variety of people with conditions that doctors and medical experts assumed would put them at greater risk than the average person. However, when the list first came about, there was no data on which to base it, and as with a lot of things during the pandemic, has become fine-tuned over time. A letter to GPs from NHS England said a new data-driven risk assessment has been developed to help identify people who may be at risk from COVID-19. The letter adds, it has been used at a national level to help identify an additional group of patients with specific multiple risk factors which, combined, may put them at similar risk to those who are clinically extremely vulnerable to severe outcomes. As a precautionary measure, this group will now be added to the Shielded Patient List, SPL, on the advice of the Chief Medical Officer. Dr. Jenny Harries said, "We have a new, evidence-based, data-driven, predictive risk model which allows us to identify adults with multiple risk factors that make them more vulnerable to COVID-19. trending Dr. Harris said the approach was risk-averse and aimed at protecting as many people as possible. She added, "The letter will note that this is more likely to be an overestimation of risk in a way which hopefully handles any of their anxiety." And it makes it absolutely clear that it is a choice for them if they choose to follow the shielding advice or not. That has always been the case. What it does also do, which I hope will benefit them, which is why people will hopefully be grateful to receive this, is it will prioritize them for vaccination.